Hello everyone, let's study about nephrotic syndrome and nephritic syndrome. Before going to that, let's see in brief about glomerular structure. What is this glomerulus? It consists of anastomosing network of capillaries. So it has got anastomosing network of capillaries, which is lined by these capillaries on outside. They are lined by, these are what? These are the visceral epithelium. These visceral epithelium consist of podocytes or food processes, consisting of food processes. And this Bowman capsule, on inside it is lined by parietal epithelium. So you have visceral epithelium here consisting of podocytes and food process, and this Bowman's capsule, on inside it is lined by parietal epithelium. So in between this visceral epithelium and parietal epithelium, there is a space. This space is known as urinary space. So urinary space is encircled by parietal epithelium, and outside of the capillary wall there are visceral epithelium. And inside the capillary wall there is fenestrated endothelial lining. And these capillaries are supported by mesenchymal cells along with mesenchymal matrix. Let's go to nephrotic syndrome. All the glomerular disease, the majority of the cases, the common cause will be immunological. Let's first coming to nephrotic syndrome. There is derangement of this capillary wall of the glomerulus. When this capillary wall is deranged, there is increased permeability of plasma protein. So as plasma protein is lost, there is heavy proteinuria, usually more than 3.5 gram per deciliter. This heavy proteinuria is also known as a nephrotic range of proteinuria. So when the protein is lost, the serum protein level is reduced. So the second symptom here is serum albumin is reduced. There is hypoalbuminemia. As a result of protein loss in the serum, there is decreased plasma oncotic pressure. So plasma colloidal osmotic pressure is reduced due to decreased albumin or due to heavy proteinuria. As a result, there is leakage of the fluid into the extravascular space. As a result, the intravascular space volume is reduced, which stimulate renin. There is activation of renin-aldosterone or renin-angiotensin-aldosterone axis. This causes salt water retention. As a result, there is edema. Okay. Also, you can see hyperlipidemia. The cause for this is not yet known, but it is believed to be because of hypoalbumin level, which triggers the synthesis of lipoprotein in the liver. Or they also believe that this massive proteinuria causes loss of an inhibitor for the synthesis of lipid. So there is increased synthesis of lipoprotein, there is hyperlipidemia. Also this is lost in the urine, that is lipiduria is also seen. So we have nephrotic range of proteinuria, we have serum albumin level is decreased, then there is edema, there is hyperlipidemia, there is lipiduria. These are the symptoms you see in nephrotic syndrome. What are the causes for this? In adult it is focal segmental glomerulosclerosis. In child it is usually, or children it is usually minimal change disease. Also membranous nephropathy, membranoproliferative glomerulonephritis. Nephritic syndrome, it is acute in onset, it is an inflammatory lesion. There is proliferation of cells within the glomeruli along with leukocytes. So I told you it is an inflammatory reaction. So there is injury to the capillary wall of the glomerulus. When there is injury to the capillary wall, RBCs or there is in the blood, that is hematuria is seen. Also the protein is lost. So there is proteinuria, but it is non-nephrotic range. It is less compared to nephrotic syndrome. So as a result of hematuria and proteinuria, there is hemodynamic change, which results in reduced GFR. When there is reduced GFR, there is oliguria. As a result of oliguria, there is fluid retention, as a result of which there is azotemia. Also, there is hypertension. This hypertension is one due to fluid retention, another due to decreased supply of blood to the kidney. There is ischemia to the kidney which augment renin-angiotensin. So as a result, there is hypertension. So these are the symptoms in nephritic syndrome: hematuria, proteinuria, which is non-nephrotic range, oliguria, azotemia, and hypertension. The causes here are post-streptococcal glomerulonephritis, crescentic glomerulonephritis, and various systemic disease such as SLE.